Good morning. Hope you're doing well today. Hey, today we're continuing our conversation in chapter 6. This is the chronic adaptations that occur due to aerobic exercise. Here we go. Regular exercise and training elicit a range of chronic cardiovascular responses, which are adaptations that occur over time in response to consistent physical activity. These adaptations enhance cardiovascular function, improve endurance, and promote overall cardiovascular health. Here are some key chronic cardiovascular responses to exercise. You see an increase in stroke volume. Stroke volume refers to the amount of blood ejected from the heart with each heartbeat. Regular exercise leads to an increase in stroke volume, primarily due to a more efficient filling of that left ventricle and improved contractility of the heart muscle. This allows the heart to pump out a larger volume of blood with each beat. You see a decrease in resting heart rate. Regular exercise results in a lower resting heart rate. This is primarily due to an increase in stroke volume, which again allows the heart to pump a larger volume of blood per beat and reduces the need for a higher heart rate to meet the body's oxygen demands at rest. You also see an increase in cardiac output. Cardiac output is the total volume of blood pumped by the heart per minute. With regular exercise, cardiac output increases due to a combination of increased stroke volume and a lower resting heart rate. This enables more efficient delivery of oxygen and nutrients to the working muscles and other organs. There's also an increase in blood pressure control. Regular exercise can help regulate blood pressure. It leads to a decrease in resting blood pressure and an improved ability to control blood pressure during periods of physical activity and stress. Exercise helps to reduce peripheral resistance, improving arterial elasticity and enhance the function of blood vessel walls, thereby promoting optimal blood flow. There's also an increase in capillary density. So capillaries are those small blood vessels responsible for the exchange of oxygen and nutrients that we talked about in chapter 2. Regular exercise stimulates the growth of these new capillaries and increases capillary density within the muscles. This improves blood flow and enhances oxygen and nutrient delivery to the working muscles, improving endurance and exercise performance. You see an increase in blood volume. So regular exercise promotes an increase in blood volume. This is achieved through an expansion of plasma volume, which improves the blood's ability to carry oxygen and nutrients. The increased blood volume also helps to maintain blood pressure and enhances the efficiency of the cardiovascular system. There's improved oxygen extraction. So with regular exercise, you're improving the ability of the muscles to extract and utilize oxygen from the blood. That's achieved through a combination of an increase in capillary density that we just talked about, an improved oxygen carrying capacity of the blood, and enhanced mitochondrial function within the muscle cells. Regular exercise has been shown to reduce the risk of cardiovascular exercises, including coronary heart disease, heart attacks, and strokes. Exercise promotes favorable changes in blood lipid profiles, reduces inflammation, improves endothelial function, or the function of the blood vessel walls, and helps maintain a healthy body weight, all of which contribute to cardiovascular health. These chronic adaptations to exercise are adaptations that occur as a result of regular physical activity. They contribute to improved cardiovascular fitness, increased exercise capacity, and a reduced risk of cardiovascular diseases. It is important to note that the magnitude and extent of those adaptations may vary depending on factors such as exercise intensity, duration, frequency, and individual characteristics. Chronic exercise leads to several adaptations in the ventilatory system as well, resulting in improved ventilatory efficiency. Ventilatory efficiency refers to the ability of the respiratory system to meet the oxygen demands of the body, while efficiently removing carbon dioxide without unnecessary strain or excessive work. Here are some adaptations in ventilatory efficiency with chronic exercise. There's an increase in lung capacity, which is the total volume of air that the lungs can hold. This is primarily achieved through an increase in vital capacity, which is the maximum volume of air that can be exhaled after a maximum inhalation. The increased lung capacity allows for a greater exchange of oxygen and carbon dioxide during exercise. Pulmonary diffusion refers to the movement of oxygen from the alveoli air sacs in the lungs into the bloodstream and the transfer of carbon dioxide from the bloodstream to the alveoli for exhalation. With chronic exercise, pulmonary diffusion becomes more efficient, allowing for a more rapid exchange of gases and improved oxygen uptake. You'll see an improvement in respiratory muscle strength and endurance. Regular exercise helps to strengthen those respiratory muscles, such as the diaphragm and the intercostal muscles. The increased strength and endurance of these muscles enables more forceful contractions and improved ventilation during exercise. This reduces the effort required for breathing and enhances ventilatory efficiency. Increase in ventilatory control. So with chronic exercise, it enhances the sensitivity and responsiveness of the respiratory control centers in the brainstem. This leads to more precise regulation of breathing, ensuring that ventilation matches the metabolic demands of the body. Ventilatory control becomes more efficient with a better coordination of the respiratory muscles and an optimized balance between oxygen supply and carbon dioxide removal. Regular exercise improves the ability of the muscles to extract and utilize oxygen from the blood, reducing the need for excessive ventilation to meet the oxygen demands and enhances ventilatory efficiency. There is a reduced ventilatory equivalent for oxygen. So the ventilatory equivalent for oxygen is a measure of the amount of ventilation required to supply a given amount of oxygen uptake. With chronic exercise, VE and VO2 decreases, indicating a more efficient ventilation to oxygen uptake ratio. This means that less ventilation is required to meet oxygen demands during exercise and reflecting improved ventilatory efficiency. The ventilatory threshold is the point during exercise at which ventilation increases disproportionately to oxygen uptake. With chronic exercise, that ventilatory threshold tends to shift to a higher workload. This allows for a better match between ventilation and oxygen uptake, delaying the onset of excessive ventilatory responses and improving ventilatory efficiency. These adaptations in ventilatory efficiency with chronic exercise enable the respiratory system to meet the oxygen demands of the body more effectively while optimizing carbon dioxide removal. They contribute to improved exercise performance, enhanced endurance, and a reduced sense of breathlessness during physical activity. Of course, the specific adaptations vary depending on the type and intensity and duration of exercise, as well as the individual factors, such as fitness level and genetics. Chronic aerobic exercise refers to the consistent and prolonged engagement in aerobic activities over an extended period of time. The adaptations that occur in skeletal muscle as a result of chronic aerobic exercise are similar to those mentioned earlier, but tend to be more pronounced and widespread. Here are some of the specific skeletal muscle adaptations that occur with chronic aerobic exercise. There's an increase in muscle fiber. Chronic aerobic exercise can lead to hypertrophy or an increase in the size of muscle fiber. While the extent of hypertrophy may not be as significant as it would be typically observed with resistance training, there is evidence that endurance exercise can promote muscle fiber growth, particularly in type 1 slow twitch fibers. With chronic aerobic exercise, there is often a shift towards a greater proportion of slow twitch or type 1 muscle fibers. These fibers have a high oxidative capacity and are more fatigue resistant, making them well suited for endurance activities. The transition to a higher percentage of low twitch fibers contributes to improved endurance performance. There's an increase in mitochondrial density. Mitochondria play a crucial role in aerobic energy production. With chronic aerobic exercise, there is an increase in the number and size of mitochondria within muscle cells, a process known as mitochondrial biogenesis. This adaptation enhances the muscle's capacity to produce ATP aerobically, improving endurance and energy efficiency. Chronic aerobic exercise leads to an upregulation of enzymes involved in oxidative metabolism. These enzymes include citrate synthase, succinate dehydrogenase, and cytochrome oxidase, which are responsible for the breakdown of fuels such as glucose and fatty acids to produce ATP. The increased activity of these enzymes further improves the muscle's ability to utilize oxygen and energy substrates. Chronic aerobic exercise stimulates the growth of new capillaries around muscle fibers, leading to increased capillarization. This enhanced network of blood vessels improves oxygen and nutrient delivery to the muscles, facilitating better endurance performance. Myoglobin, which is a protein that binds and transports oxygen within muscle cells, is elevated with chronic aerobic exercise. The higher myoglobin content allows for more efficient oxygen delivery to the mitochondria, supporting sustained aerobic energy production. Chronic aerobic exercise improves the muscle's capacity to store and utilize glycogen, the stored form of glucose. This adaptation helps to maintain optimal fuel availability during long-duration exercise, delaying the onset of fatigue. Chronic aerobic exercise enhances the communication between the nervous system and skeletal muscles, improving neuromuscular coordination. This improved coordination allows for more efficient muscular contractions and movement patterns, enhancing overall exercise performance. These adaptations occur gradually over time with consistent engagement in aerobic exercise. The magnitude and rate of adaptation can vary depending on factors such as exercise intensity, duration, frequency, and individual genetic predisposition. It's worth noting that the adaptations observed in specific muscle groups may differ based on the type of aerobic exercise performed, whether that's running, cycling, swimming, and the specific muscles involved in the activity. Chronic aerobic exercise elicits various metabolic adaptations in the body, which contribute to improved energy production and utilization. Here are some of the key metabolic adaptations that occur with chronic aerobic exercise. Increased mitochondrial density. Mitochondria are the energy-producing organelles within cells, and chronic aerobic exercise leads to an increase in their number and size. This increase in mitochondrial density enhances the muscle's capacity for aerobic energy production and oxidative metabolism, allowing for more efficient utilization of fuels like glucose and fatty acids. Chronic aerobic exercise stimulates the upregulation of enzymes involved in oxidative metabolism. Enzymes such as citrate synthase and succinate dehydrogenase and cytochrome oxidase increase in activity. These enzymes facilitate the breakdown of fuels and production of ATP through aerobic pathways, improving the muscle's ability to generate energy during aerobic endurance activities. There's an increase in fat oxidation. One of the notable metabolic adaptations to chronic aerobic exercise is an enhanced ability to oxidize or break down fat as a fuel source. Regular aerobic exercise increases the activity of enzymes involved in fat metabolism, such as hormone-sensitive lipase and carnitine palmitoyltransferase, or CPT1. This adaptation leads to a greater reliance on fatty acids for energy during exercise, conserving glycogen stores and prolonging endurance. There's an improvement in glycogen storage and utilization. So chronic aerobic exercise improves the muscle's capacity to store glycogen, which is a stored form of glucose. This adaptation allows for a greater reservoir of readily available glucose for energy production during exercise. Furthermore, endurance training enhances the muscle's ability to utilize glycogen efficiently, delaying the depletion of glycogen stores and reducing the reliance on muscle protein breakdown for energy. There's an increase in lactate threshold. That lactate threshold refers to the exercise intensity at which there is a significant increase in blood lactate levels. With chronic aerobic exercise, the lactate threshold tends to increase. This adaptation reflects improved lactate clearance and utilization by the muscles, allowing for higher intensity exercise before the onset of muscle fatigue. Chronic aerobic exercise increases the muscle sensitivity to insulin, resulting in improved glucose uptake. This adaptation is associated with an upregulation of glucose transporters such as GLUT4 on the muscle cell membrane. As a result, the muscles take up more glucose more efficiently from the bloodstream, supporting energy production during exercise. With chronic aerobic exercise, the body becomes more efficient at utilizing energy substrates to produce ATP. This efficiency is reflected in a lower oxygen consumption, or VO2, at a given exercise intensity. The enhanced energy efficiency allows an individual to exercise for longer durations without excessive fatigue. It's important to note that these specific metabolic adaptations, again, are factoring on exercise intensity, duration, frequency, and individual characteristics. Additionally, these adaptations pertain to skeletal muscle, but chronic aerobic exercise also influences metabolism in other organs and tissues. Chronic aerobic exercise can elicit several endocrine adaptations in the body, leading to hormonal changes that contribute to improved metabolism, body composition, and overall health. Here are some of the key endocrine adaptations that occur with chronic aerobic exercise. There's an increase in secretion of endorphins. Endorphins are those endogenous opioids that act as natural painkillers and mood enhancers. Chronic aerobic exercise stimulates the release of endorphins, leading to a feeling of euphoria and reduced perception of pain. And it's commonly known as the runner's high. There are changes in insulin sensitivity. So with regular aerobic exercise, it improves insulin sensitivity, which is the body's responsiveness to insulin. Insulin is a hormone that regulates glucose metabolism. With chronic aerobic exercise, insulin sensitivity increases, allowing for better glucose uptake by cells and improved blood sugar control. This adaptation is particularly beneficial for individuals at risk for developing type 2 diabetes or those with insulin resistance. Alterations in cortisol levels. Cortisol is a stress hormone released by the adrenal glands. Acute bouts of aerobic exercise temporarily increase cortisol levels. However, with chronic aerobic exercise, the body becomes more efficient at regulating cortisol production, resulting in lower resting levels of cortisol. This adaptation can have positive effects on stress management and overall health, as chronically elevated cortisol levels have been associated with negative health outcomes. Changes in growth hormone secretion. Growth hormone is involved in regulating metabolism, promoting protein synthesis, and facilitating tissue repair. Chronic aerobic exercise can lead to an increased secretion of growth hormone, particularly during high-intensity exercise. This hormonal response contributes to the maintenance and growth of lean muscle tissue, as well as the mobilization of stored fat for energy. Alterations in the thyroid hormone levels. Regular aerobic exercise can influence thyroid hormone levels. While the changes can vary, chronic aerobic exercise has been shown to increase levels of triiodothyronine, or T3, and decrease levels of reverse T3. This shift indicates an improvement in thyroid hormone function and metabolism, which can contribute to increased energy expenditure and overall metabolic rate. Modulation of leptin and ghrelin levels. Leptin and ghrelin are hormones involved in regulating appetite and energy balance. Chronic aerobic exercise can influence these hormones. Exercise has been shown to increase leptin levels, which helps regulate food intake and satiety. Additionally, it can reduce ghrelin levels, which is known as the hunger hormone, thus helping to suppress the appetite. Chronic aerobic exercise can influence sex hormone levels as well, including testosterone and estrogen. In general, regular aerobic exercise tends to result in favorable hormonal profiles, such as increased testosterone levels in men and improved estrogen balance in women. These changes can contribute to improved body composition, muscle mass, and overall health. It's important to note that the specific endocrine adaptations can vary depending on factors such as exercise intensity, duration, frequency, and individual characteristics. Additionally, the interplay between different hormones and their adaptations is complex. Further research is still ongoing to fully understand the mechanisms and long-term effects of the endocrine changes induced by chronic aerobic exercise. Chronic exercise has significant effects on body composition, leading to changes in fat mass, muscle mass, and overall body shape and composition. Regular physical activity, particularly a combination of aerobic exercise and resistance training, can result in the following body composition adaptations. Reduction in body fat. So chronic exercise promotes fat loss by increasing energy expenditure and creating an energy deficit. When the body consistently burns more calories than it consumes, stored body fat is utilized for energy, leading to a decrease in overall body fat percentage. Aerobic exercise in particular helps with burning calories and enhancing fat oxidation, while resistance training can increase muscle mass and metabolic rate, further contributing to fat loss. Regular exercise, especially resistance training, stimulates muscle protein synthesis and promotes muscle growth and hypertrophy. This leads to an increase in lean muscle mass, which contributes to a more defined and toned appearance. Increased muscle mass also raises metabolic rate, as muscle tissue requires more energy to maintain compared to fat tissue. Chronic exercise can result in a favorable change in the ratio of lean mass to fat mass. This means that while body fat decreases, lean muscle mass increases or is preserved. This shift in body composition improves overall body shape, enhances physical performance, and supports metabolic health. Regular exercise, particularly resistance training, can lead to reductions in waist circumference and girth measurements. Exercise-induced fat loss combined with an increase in muscle mass contributes to a more defined waistline and improved body shape. Weight-bearing exercise and resistance training help stimulate bone formation and increase bone mineral density. Chronic exercise can help maintain and improve bone density, reducing the risk of osteoporosis. And exercise, especially exercises that target core muscles, promote postural awareness and can improve posture and body alignment. Strengthening the muscles of the core, back, and shoulders can help alleviate imbalances and improve overall body posture and alignment. Regular exercise, particularly high intensity training and resistance training, can improve metabolic efficiency. This means that the body becomes more efficient at utilizing and metabolizing nutrients such as carbohydrates and fats for energy production. Improved metabolic efficiency can contribute to better body composition and weight management. It's important to note that individual responses can vary based on factors such as genetics, age, sex, diet, and exercise regimen. Additionally, the specific body composition adaptations will depend on the type, intensity, duration, and frequency of exercise performed. A well-rounded exercise program that includes a combination of aerobic exercise, resistance training, and flexibility is generally recommended for achieving optimal body composition changes. There are several factors that influence the adaptations that occur in response to chronic exercise. These factors can affect the magnitude and type of adaptations as well as the rate at which they occur. Here are some of the key factors that influence adaptations to chronic exercise. The exercise type. Different types of exercise elicit different responses. Aerobic exercise primarily leads to cardiovascular and endurance types adaptations, while resistance training promotes muscle hypertrophy and strength gains. High intensity interval training can enhance both aerobic and endurance or anaerobic capacities. The specific exercise modalities such as running, cycling, weightlifting, or swimming can also impact the adaptations that occur. There are individual factors such as age, sex, genetics, fitness level, and baseline characteristics that can influence the adaptations to chronic exercise. Age-related changes, hormonal differences, and genetic variations can impact the rate and extent of adaptations. Additionally, the individual's training history and prior experience with exercise can influence the response to chronic exercise as well. The intensity of exercise plays a crucial role in determining the adaptations. Higher intensity exercise, such as high intensity interval training or heavy resistance training, typically results in greater physiological and metabolic adaptations compared to low intensity exercise. Intensity can be manipulated through factors like workload, heart rate, or perceived exertion. The duration and frequency of exercise sessions also influence adaptations. Longer exercise durations and more frequent training sessions generally lead to greater physiological adaptations. For example, longer duration aerobic exercise can enhance cardiovascular capacity, while frequent resistant training sessions can improve muscle hypertrophy. Gradual progression of exercise is important for stimulating adaptations. By gradually increasing the intensity, duration, or frequency over time. The body is continuously challenged and prompted to adapt. Progressive overload is a key principle in exercise programming to promote ongoing adaptation. Sex and age are two important factors that influence the adaptations to aerobic exercise. Here's how these factors come into play. With sex hormonal differences, the sex hormones such as testosterone and estrogen play a role in shaping the adaptations to aerobic exercise. Testosterone, which is generally higher in males, promotes muscle growth and strength gains, potentially leading to greater improvements in aerobic performance. On the other hand, estrogen in females may contribute to a higher proportion of type 1 muscle fibers and improved muscle endurance. Males tend to have a higher proportion of muscle mass, while females often have a higher percentage of body fat. These differences can affect energy metabolism and substrate utilization during aerobic exercise. Males may rely more on carbohydrate oxidation, while females may have a greater capacity for fat oxidation. Research suggests that males may experience slightly greater gains in aerobic capacity, such as VO2 max, compared to females. However, it's important to note that individual variations within each sex are significant, and training intensity, duration, and other factors contribute to the overall response to aerobic exercise. In regards to age, there are hormonal changes that as an individual ages that can influence adaptations to aerobic exercise. In both males and females, the decline in sex hormones such as testosterone and estrogen can affect muscle mass, strength, and recovery. This can result in a reduced capacity for muscle hypertrophy and changes in body composition. And aging is associated with a natural decline in aerobic capacity, largely due to reduced cardiovascular function, decreased lung capacity, and alterations in skeletal muscle. The decline can impact the magnitude of adaptations seen with aerobic exercise in older individuals. Older individuals can still experience significant improvements in aerobic capacity and overall fitness with regular aerobic exercise. However, it may take longer to achieve these adaptations compared to younger individuals. It's important to note that older individuals should consider their current health status and any potential limitations when engaging in aerobic exercise. While sex and age can influence adaptations to aerobic exercise, again, it's important to remember that these factors are just a few among that may impact individual responses. You also, again, have to take into play genetics, training history, overall health status, lifestyle factors, and training program design especially when you are helping to make adaptations to aerobic exercise. Individual variability is substantial, and it's best to focus on personalized training approaches than consider the unique characteristics and goals of each individual. Overreaching and overtraining are both conditions that occur when an individual exceeds their body's ability to recover from exercise and adapt to the physical stresses placed on it. However, there are some important distinctions between the two. Overreaching is a planned and controlled phase of intense training where an athlete intentionally pushes their body to the limit for a short period. It's often a part of periodized training programs aimed at achieving performance gains. During overreaching, athletes typically experience an acute decrease in performance due to accumulated fatigue. However, with adequate rest and recovery, performance levels can rebound and supercompensation may occur, leading to improved performance. Overtraining, on the other hand, is a more severe and prolonged state of fatigue and reduced performance resulting from excessive and prolonged training without adequate recovery. It occurs when the demands of training exceed the body's ability to adapt and recover. Overtraining can lead to a variety of physical and psychological symptoms that significantly impact athletic performance and overall well-being. Here are some of the features of overreaching and overtraining. Overreaching, there's an intentional and planned phase of intense training. It's short-term, typically lasting a few days to weeks. Performance decrements are reversible with adequate rest and recovery. And it may be followed by supercompensation and improved performance and can be a beneficial part of a well-designed training program. On the other hand, overtraining is unintentional, excessive training without proper recovery, prolonged and chronic states that last weeks to months. persistent and worsening performance decrements and may lead to a range of physical and psychological symptoms such as fatigue, decreased motivation, mood disturbances, decreased immune function, and increased injury risk. It requires an extended period of rest and recovery to fully resolve. It's important to note that overreaching can be normal and beneficial part of training as long as it is properly managed and followed by appropriate recovery. However, overtraining is a state to be avoided as it can have detrimental effects on an individual's health and performance. Monitoring training load, listening to the body, incorporating adequate rest and recovery, and working with a qualified coach or trainer can help prevent and manage overreaching and overtraining. There are generally two types of overtraining that are commonly recognized in the field of sport and exercise science: sympathetic overtraining and parasympathetic overtraining. These two types reflect different physiological and psychological responses to excessive training and inadequate recovery. Sympathetic overtraining, also known as sympathetic overreaching, is characterized by an excessive activation of the sympathetic nervous system, which is responsible for the body's fight or flight response. This type of overtraining is often associated with high intensity training and can result from an imbalance between training stress and recovery. Key features of sympathetic overtraining include increased heart rate and blood pressure, elevated levels of stress hormones such as cortisol and epinephrine, insomnia or disrupted sleep patterns, persistent feelings of fatigue and exhaustion, decreased immune function, altered mood, irritability, and anxiety. Sympathetic overtraining is typically characterized by an overactive response of the sympathetic nervous system, leading to a state of chronic stress and reduced performance. It often requires an extended period of rest and recovery to restore the body's balance and normalize the stress response. Parasympathetic overtraining, also known as parasympathetic overreaching, is characterized by an excessive activation of the parasympathetic nervous system, which is responsible for the body's rest and digest response. This type of overtraining is often associated with high volume training and can result from prolonged periods of intense exercise without adequate recovery. Key features of parasympathetic overtraining include decreased heart rate and blood pressure, excessive fatigue and lethargy, depression and decreased motivation, increased susceptibility to infection and illness, impaired exercise performance, and altered appetite and weight loss. Parasympathetic overtraining is typically characterized by a dampened response of the autonomic nervous system, leading to a state of chronic fatigue and reduced exercise capacity. Adequate rest and recovery are necessary to restore the body's homeostasis and normalize the autonomic balance. It's important to note that these two systems of overtraining are not mutually exclusive, and individuals may experience a combination of symptoms from both types. Proper training management includes appropriate intense volume and recovery strategies and is crucial to prevent overtraining and optimize performance. Monitoring training load, listening to the body's signals, and seeking guidance from qualified professionals can help individuals avoid or recover from overtraining. Overtraining is a state of excessive physical and or mental stress caused by an imbalance between training and recovery. It can occur when an individual exceeds their capacity to adapt and recover from training. And a lot of it occurs due to several factors: their training background. An individual with a higher training background or those who have been consistently engaged in high intensity training over a long period may have greater tolerance to training volume and intensity. They may require more intense or frequent training stimuli to reach a state of overtraining compared to individuals with a lower training background. Genetic factors can influence an individual's predisposition to overtraining. Some people may have a higher innate ability to recover and adapt to training stress, while others may be more susceptible to the negative effects of overtraining. Genetic factors can affect factors such as muscle type, composition, hormone levels, and recovery abilities. Each individual has a unique capacity to recover from exercise. Factors such as sleep quality, nutrition, stress levels, and overall lifestyle habits can influence recovery abilities. Individuals with better recovery practices and habits may be more resistant to overtraining compared to those with suboptimal recovery strategies. Outside stressors in life and circumstances can impact an individual's ability to recover from training as well. Personal and professional stress, lack of sleep, poor nutrition, and other life stressors can contribute to an increased risk of overtraining. Individuals with higher stress levels or demanding lifestyles may be more prone to overtraining. Each person responds differently to training stimuli. Some individuals may require more intense or frequent training to elicit a training response, while others may be more sensitive and respond to lower training volumes or intensities. Those who are more sensitive to training may reach a state of overtraining with lower training loads. It's important to recognize that overtraining is a complex and multifactorial condition, and individual responses can vary. Monitoring training load, recovery, and paying attention to individual signs of fatigue and performance decrements is crucial to preventing overtraining. It's advisable to work with a qualified coach or sports professional who can provide personalized guidance and help manage training programs to avoid excessive stress and risk of overtraining. Detraining, also known as deconditioning or reversibility, refers to the partial or complete loss of physiological adaptations that occur as a result of discontinuing or reducing the frequency, intensity, or duration of exercise. When an individual stops or significantly reduces their training stimulus, the body undergoes certain changes that can lead to a decline in fitness levels and a reversal of fitness adaptations. Without aerobic exercise, cardiovascular fitness will decline over time. The heart becomes less efficient at pumping blood and results in a decreased stroke volume, which is the amount of blood pumped per beat. This leads to a reduction in maximal oxygen uptake, or VO2 max, which again reflects the body's ability to utilize oxygen during exercise. Blood volume, capillary density, and aerobic enzyme activity also decrease during detraining. Discontinuing resistance training or reducing the intensity and volume can result in a loss of muscular strength and power. Muscle fibers shrink in size, they atrophy, and neuromuscular adaptations that contribute to strength and power, such as increased motor unit recruitment and synchronization, diminish. The rate of strength loss varies depending on factors like initial fitness level and duration of detraining. Muscular endurance, the ability of muscles to sustain repeated contractions over time, decreases with detraining. The loss of muscle fibers, oxidative capacity, and decreased capillary density contribute to reduced endurance capacity. Rate of decline depends on the specific muscles involved and the type of exercise performed and duration of detraining. Flexibility, the range of motion around a joint, can decrease during detraining. Without regular stretching or mobility exercises, connective tissues may lose their elasticity, resulting in reduced joint range of motion and flexibility. Detraining can lead to changes in body composition. When exercise is reduced or ceased, muscle mass may decrease or muscle atrophy, while body fat levels may increase. These changes can result from decreased energy expenditure and alterations in hormonal balance. Skills specific to a particular sport or activity may deteriorate during training. Technique, coordination, and motor skills that were acquired and refined through practice and training may decline if not maintained. The rate and magnitude of detraining varies among individuals and depends on several factors, including their initial fitness level, training history, duration of detraining, and genetic factors. However, detraining can be partially reversed by returning to regular exercise and gradually reestablishing training stimulus. It's worth noting that some training adaptations, such as improved exercise technique, motor learning, and psychological factors, may have a longer lasting impact and be less prone to detraining effects compared to physiological adaptations. Nonetheless, maintaining a consistent exercise routine is essential to sustain long-term fitness and performance. And these are my references. This is the end of chapter 6. We'll continue and talking with you again. I look forward to talking to you soon. Have a great day.